I'm going to be talking about schizophrenia. So it is a challenging brain disorder because of the circumstances. It's hard to think clearly, everything is foggy, and it's hard to decipher what is real or make-believe in their world. It affects what a person thinks, the way they behave, and their perception of the world. Their perceival of reality is very skewed, and they're always seeing and hearing make-believe things that are made up in their mind. And they speak outlandish sayings and are on constant watch because they are fearful that somebody is always out to get them. Because of this behavior, people with the disorder usually escape and retreat into their own world, and they don't really continue their normal social acts. Most people think that this cannot be treated, but with the help of support groups, medications, and therapy, it is manageable, and the help of family and friends is also always great because they encourage them to carry on out their lives. Schizophrenia can all of a sudden take place, but typically there are signs to look for that are not limited to schizophrenia, but when you know that something is happening that's not normal. These signs can include mood changes, withdrawal from the outside world, normal lives are not happening, their routines are all messed up. They're always hostile or cautious of their environment around them. They cannot show signs of any joy in life, they're not very happy. Depression, insomnia, sudden inappropriate expressions such as laughing and crying are things that normally wouldn't take place. Their unusual conversations, forgetful, cannot concentrate, and their strange uses of words and speaking. These are the beginning signs, like I said, so this is when you should be on high alert and possibly go see a doctor. 5 types of symptoms specific to schizophrenia are delusions, hallucinations, disorganized speech, disorganized behavior, and so-called negative symptoms. These symptoms can differ depending on the person, but these are the 5 typical ones that people look for when diagnosing schizophrenia. The causes of schizophrenia are not technically known, but it is usually linked to genetics and environmental factors. But about 60% of people have no ties to to the schizophrenia gene. So environmental causes are prenatal exposure to viral infection, low oxygen levels during birth, exposure to virus during infancy, early parental loss or separation, physical sexual abuse during childhood. So typically it happens in an adolescent year. And some effects from schizophrenia are relationship problems, disruption to normal daily activities, alcohol or drug use, and increased suicide risk. When they diagnose, you typically first go to a doctor and they're going to do some medical testing and some history and find out what else is going on. And then if those carry on for about 6 months, they'll diagnose you with schizophrenia.